Good evening, everyone. I am Dr. Vineet Kwatra, pediatrician, senior consultant, pediatrics and neonatologist with Avni Clinic, Sector 90 Sapphire. I am also working with Artemis Light and Daffodil Hospital as head of the department. Previously, before this, I was working as a senior consultant with Medanta Hospital, Gurgaon. I have got an experience of 23 years in the field of pediatrics and neonatology. I have been dealing with all sorts of pediatric infectious diseases, pediatric asthma and respiratory problems. Along with this, I have got a keen interest in setting up the NICUs for various hospitals. Before this, I was involved in establishing the NICU for Paras Hospital as well as Meteor Hospital in Gurgaon. So friends, this is my brief introduction. Now, since we are meeting for the first time, I would like to share few of my thoughts on diseases which we find during this rainy season. So the most commonest disease which we find during this rainy season, which is coming up, is basically the diarrheal episodes, which is basically acute gastroenteritis, number 1. Number 2 is dengue fever. Number 3 is typhoid fever. So these are the basic things which we found. We don't find more of a respiratory infection. We find infections which are related to the intestines and the stomach. So to be very brief and short, let's discuss what has to be done in cases of gastroenteritis when you find the kids having loose motions and vomitings, persistent diarrheas. What things you can take care at home? So number 1, keep your child hydrated. Make him have lots and lots of water. Milk-free diet. Replenish the losses. What I mean to say by replenishing the losses is that once the baby is passing motion, replace it with 20 ml of the ORS. That is what you have to do. Check for red flag signs, like if the baby is lethargic, if the baby is not passing urine for more than 6 hours, if the baby is having persistent high-grade fever with vomitings, then kindly you have to go to your pediatrician and discuss the situation with him. Number 2, like I told you, the next phase which we get is the typhoid fever, which is very common in your rainy season. So in typhoid fever, the first and the foremost important thing is that it is an infection of the intestine, and it basically leads to a very, very high grade fever, which is a step ladder pattern. So the fever starts by 99, the next day it goes to 100, the next day it goes to 101, and then the fever can reach up to 103 or 104. Now, the fever does not come down with crocin or any other anti-inflammatory or antipyretic medicines. Now, once the fever is high and if it goes beyond 3 or 4 days, then you really have to check it out with your pediatrician, because yes, it may turn out to be a typhoid fever. Now, along with the fever, the symptoms which we find in typhoid in kids is they may have loose motions or vomitings, they may have abdominal pain and cramps, they may be very lethargic, they may be very tired, and they generally complain of severe body ache and poor appetite. So this was a small thing about the typhoid. That is why we always reiterate our patients that typhoid vaccination is very important to prevent our kids from having severe forms of typhoid. So go ahead, show to your doctor when the fever is beyond 3 or 4 days, get him investigated, and be sure that you have to get a typhoid vaccination done. Number 3, which I was talking about, was dengue. See, dengue fever, again, the fever is basically caused by mosquitoes. And normally this kind of fever is a very high grade fever to 2 to 3 days, and then suddenly you will find that the fever will go off and you will find little bit red patches on the body. So whenever you find such things in your kids, immediately report to our doctor so that we can investigate your child and then go ahead further the things. So these are the basic 3 things which I wanted to discuss on our first visit. Let's keep it short and simple, and let's keep your kids safe and happy and healthy always. This is signing up from Dr. Vineet Kwatra. Thanks a lot.